Good afternoon, everyone, and welcome to the 28th session of the series of talks in the theme of Wisdom for Living, which is initiated by the Theosophical Society more than 2 years ago. And I am very happy to inform to all that Mr. Ramkumar is the coordinator of this program, and every month he has been bringing the speakers who have wealth of knowledge, information regarding various aspects of human life. Along with it, those speakers have contributed to society in their own way, which is the most important thing when we talk about wisdom. Because information is one thing and wisdom is another thing. And so, on behalf of Theosophical Society, I welcome you all. And the necessity of this small yet profound initiative was felt for a long, long time. Why I say small? Because yes, it may seem once in a month, few people, 40, 50, 60 people come together and hear a talk in comparison to a billion people, 1.4 billion in India and about 6 billion in the world. What difference does it make? But we all know that no matter how long the journey is, how great the achievement is, it always starts from the first step that is taken in the direction. And so, this step from the Theosophical Society, which is a very necessary step, which I will come to in a while, has its own value. Because for majority of people, what is Theosophical Society? When you say Theosophical Society, it is a place very naturally beautiful, located in a very prime location on the confluence of ocean on one hand, on one side, and the river on the another side, and full of multitude of trees, flora, fauna, different varieties and species of plants, insects, butterflies, which can, almost, if someone comes here for the first time, they can, think that they are not in Chennai at all. And this place is also often called one of the lungs of Chennai due to its greenery. But this place is something more than that. It is not just naturally beautiful. This place has its own spiritual vibrations, the charge that many of the people who come with that approach can feel it, apart from the philosophy of theosophy that this place became the center of in 1882. Philosophy that is theosophy. And about that philosophy, very few people are aware of it, that many people do not know what Theosophical Society does. It's a big place, there are things happening, but what does it actually do? So the mission statement of the Theosophical Society gives us a small peek into that. And what is the mission of the Theosophical Society? It says, to serve humanity. So these three words of the beginning of the statement itself gives us the hint about the work of Theosophical Society and Theosophy. Because no matter which spiritual path a person is following, which guru they are following, which religion they are following, everywhere ultimately it comes down to service. I may be a great yogi, but if I am not contributing in serving my fellow humans or other life, then that yoga is of no use. I may be a brilliant scholar. I may have many achievements in life, but if my knowledge is not being used for the welfare of the large population, it's of no use. And that is why service is the first and foremost expression of a philosophy that is theosophy. And how this service is inculcated in a person? To serve humanity by cultivating an ever deepening understanding and realization. So we cannot force a person to do service. That is called slavery. When you force a person to serve, it is called, you are making a person a slave, or the other person may be a robot. But how to initiate the spark of service in a person can only happen when that person realizes something, understands something. And what is that understanding? Ever deepening understanding and realization of the ageless wisdom. That is Sanatan Gyan, we can say, or Brahma Vidya or Theosophy, is spiritual self-transformation and unity of all life. So these three things, ageless wisdom, spiritual self-transformation and unity of all life, I feel all these three are kind of synonymous. Because when there is a spiritual transformation by understanding ageless wisdom, it is basically realizing the oneness of life. And that is what exactly when Annie Besant, the second president of the Theosophical Society, was asked to share her whole experience or whole understanding of Theosophy in few lines, she penned down one 4-line, I would say, prayer, or what now we call universal prayer, in 1923. And I request all of you to join me in that. You can remain seated. And while saying it after me, you can give your attention to each and every word, not to say it in a hurry. And then we proceed. O hidden life, vibrant in every atom. O hidden light, shining in every creature. O hidden love, embracing all in oneness. May each who feels himself as one with thee know he is also one with every other. So these were the words that came out from Annie Besant's pen. And yes, we may think that this state of mind where we see that hidden light, hidden life, hidden love in everybody, which is binding us, we may think this is a very high state of a yogi, which actually is. And there is a prejudice or conditioning in majority of people that such state of mind can only be attained by cutting oneself off from rest of the humanity or society and focusing on one's own spiritual evolution, development, and you can reach that state. But here is what is a slight difference, that Theosophy says that that state can be realized and must be realized among the society, not leaving the society, but being in the society, being in touch with other life forms, whether it's human, animal, plant, or other minerals, in whichever form the life is expressed. And that is why there is no such difference between a spiritual life and a material life. Like normally people say, oh, he is leading a spiritual life, or he is a materialistic person. There is no such division in consciousness. A person can be highly spiritual while living a material life, or a person can be highly materialistic living in a monastery. So it is all the state of mind, and that is why in this Wisdom for Living series talks, we have invited speakers from across the spectrum of human activity, be it arts, be it science, be it medical science, astrology, astronomy, fitness, ecology, spirituality, and whatnot, even from the art of making people laugh. So everything can be made spiritual. And especially the people who speak, who come here, that who have experienced and applied those principles in their life to their work, which is not only desirable but also very, very necessary. Because the way the times are going, the way the world is going, where stress has become the epidemic, health epidemic of the 21st century, it means there is something seriously wrong the way we are living our lives. So only this change, this transformation can bring about the peace. And one of the consequences of such stress in our daily life is diabetes, I guess. And so to talk on that subject, that is the subject which we are going to focus on, which is very, very important and contemporary, which is becoming the cause of concern not only in the old but also in the young, is diabetes. So the theme for today, as you know, is self-care of diabetes. And to share his thoughts and experience on this subject, we have Dr. A Srivatsa here with us, a senior consultant physician and a diabetologist. He has extensive experience and expertise in diabetes care, and his impressive background includes his medical degree from the MRMC Gulbarga in 1989, fellowship in diabetes studies from UK in 96-97, postgraduate diploma in diabetes from Middlesex University in 2017, and he has published over 18 scientific papers in national and international journals. And his research experience has taken him to participate in the phase 3 trials for this. He has also been the invited speaker at various forums and key role in organizing national and international conferences. Also, as part of his academic contributions, he has been the faculty of ADA postgraduate diploma, postgraduate program in India, and he has been actively involved in raising awareness about diabetes and its associated comorbidities. Dr. Srivatsa's dedication to advancing diabetes care has earned him a reputation as a leading expert in the field, and his contributions to the medical community and public education initiatives are truly commendable. And without further ado, I request Dr. Srivatsa to come and take the mic and share with us his experience and his knowledge on this important subject. Dr. Srivatsa.
Thank you, sir. I thank Theosophical Society for giving me this opportunity to talk on diabetes education to you all. And I thank Mr. Ramkumar for inviting me for this lecture. Diabetes is a common medical issue faced in the public, and it is increasingly prevalent among younger population also. We are all living longer. Since we are living longer, we'll have to have one of them as diabetes, heart issues, kidney issue, a stroke, or a cancer. These are the major medical issues as we grow older. But diabetes is seen in the young as 3 months old, and as old as 95, 96 years old also. The difference is in the usage of medication in type 1 and type 2 diabetes. Here I am trying to educate you on how to take care of diabetes by yourselves once you are diagnosed with diabetes. But basically, doctors only advise the individual is responsible for taking care of his diabetes or her diabetes. technically, diabetes is a chronic medical condition where uh, the blood sugar remain in the blood. Insulin is the drug of which is secreted from the pancreas, helps the insulin sugar enter a cell from the blood. If the secretion of insulin is less or not there, then you develop diabetes. The state where sugars remain above normal, which is fasting above 126 and postprandial above 200, this state is called as diabetes. Then, depending on the age, we classify it into type 1, type 2. Then during pregnancy is gestational diabetes. This is all you require. So, as I said, insulin is produced by the beta cells in the pancreas, and type 1 diabetes is basically seen in children and young people because there are insulin destroying antibodies developed by the body due to unknown reasons. They are not, type 1 is not hereditary, it is autoimmune. It is because of destruction of the beta cells in the pancreas. So usually type 1 diabetes occurs in young age. It is autoimmune, as I said, and sometimes it is linked to the environmental conditions, and some mumps can cause it in young children. These are the findings. Type 2 diabetes is the commonest diabetes we all suffer. It is seen in above the age of 30, overweight. They are dependent on oral drugs for management of diabetes. Irrespective of their race, you can develop it, and people who have had gestational diabetes are likely to get diabetes type 2 at an older age. And we are increasingly physically inactive. These are the reasons for precipitating type 2 diabetes. So, why are we concerned about diabetes? Diabetes, if not controlled. What is control? Control is fasting less than 120, postprandial less than 180 is control of diabetes. Diabetes does not control. Over a period of time, blood vessels thicken, affecting eyes, nerves, heart, and the kidney. Eyes affecting the eyes is called as retinopathy, kidney is called nephropathy, and nerves is called neuropathy. So the nerves become weak, your sensations become poor, numbness, burning feet, and then you can have a tingling sensation in the feet. Then even if you have an injury, you will not be able to notice it because of your numbness. These are the changes in the nerves. And foot being the furthest away from the body, they are the first thing to be affecting in a person with diabetes. In what I have studied here, 25% of the population coming to clinic at diagnosis can have neuropathy. And even without diabetes, you can develop neuropathy. But retinopathy and nephropathy to occur, you have to have minimum of 10 to 15 years of diabetes or uncontrolled diabetes for a long period of time, 300 or 400 for a longer period of time. But it is usually seen after 15-20 years of diabetes. In a type 2 diabetes, at diagnosis, around he is 55-60 years old, at time of diagnosis, he can develop all the complications of affecting eyes, nerves, heart, and the kidney for the first time. Because it is said that diabetes remains dormant without outer symptoms for a long period of time. So, accidentally we diagnose diabetes in people who come for investigation for some other fever or cough, cold, or any other LIC policies or some travel insurance, they come there. So, if you see the chronic complications affecting diabetes, then you have the heart attacks, strokes, peripheral vascular blood supply to the legs being cut off. That also causes a problem because of diabetes. That is augmented with smoking. If a smoker is there, it constricts the blood vessel. Diabetes thickens the blood vessel. So it affects both things. Smokers have more risk of developing peripheral disease or dry gangrenes in the feet. And we are living longer, so these are all things that can happen. So as I said, fasting above 126, 200 is diabetes, and control is around 120 and below, and 180 and below. But most of us get confused with the lab report saying fasting less than 100, postprandial less than 140. They are normal values. Once we develop diabetes, we cannot expect us to get that normal values. Because if I want to get the normal values, I have to over-treat you with high medication to get low sugars. So low sugars are more dangerous than high blood sugars. So how do you manage diabetes? We manage with nutrition, regular exercise, and medication. All this play a major role in management. Food has to be on regular timings, eat food on time, eat in a regular interval, once in 2 hours something has to go in, without much of carbohydrate. Then avoid all refined sugars or simple sugars. What is simple sugar means? When I touch it, the sugar or sugary thing, in the tongue, sugar starts going up in the blood, like sugar, jaggery, nati sakara, karupati, vellam, then honey. They all, once you touch in the tongue, the sugar starts rising from the blood. So that body is not easily able to overcome. So testing diabetes, eating food on time, doing regular exercise of 30 minutes a day helps us control diabetes. Once we control diabetes, problems, research has said that the diabetic related complications are postponed. HbA1c is one factor which we are treatment goal across the globe. 6 and below is normal, 6 to 7 is good control, 7 to 8 is fair control, above 8 is poor control. This is the 3 months average of blood sugar. If I am newly diagnosed diabetic, I go give a blood sample. If it is 10 and I start my treatment, it is going on the right direction, the 10 will come to 7. If I am not adhering to diet or not behaving properly or medicine not working, then it will go to 11. So it gives us a guide to the doctor and the patient that we are missing something. I may have normal values, but my HbA1c will be on the higher side. It means in the last 3 weeks or 4 weeks, he has had a rich food, which includes a sweet or some rich food he has had. This is my observation in my clinical practice. So, caring for self, exercise is important. Exercise improves circulation, exercise improves good cholesterol, exercise improves heart-lung functioning, respiratory conditioning, then it decreases glucose, medicine requirement comes down. And also research has said, if after 60, if you walk for 10 minutes, you live 3 years longer. So this is all scientifically proven. So at least half an hour of exercise is good for controlling diabetes. You can walk anytime, anywhere, no restrictions. You don't, except coming to Theosophical Society, other places you can just walk without any fee. And irrespective of the time, you can walk. So walking is beneficial than jogging, or as we grow old, our reflexes come down, knee joint bones become brittle, so it is better to walk. Eating food on time, then medication based on your doctor's advice, you have to be regular on your medicines. Monitoring diabetes is most important. Why? Your breakfast, lunch, dinner is never the same. Exercise pattern is different every day, or sometimes you do, sometimes we may not do. Then stress factors are different every day. So, multiple variable input, your output is going to be variable. By looking at your face, I will not be able to tell it is 100, 200 or 300. We have to monitor. Today, monitoring techniques have become easy. glucose meters are there, continuous glucose monitoring devices are there, which can give you the time and range. So now the essence of doctors is to see how much time in range your glucose has been there with continuous glucose monitoring. This helps us better understanding of diabetes in one's life. Say he says hypo at 2 o'clock in the morning or high sugars early morning, feeling giddy when I get up or something. We are able to monitor the exact time and the reason why we are able to see the sugars are going high or low. Recently, Dr. M. Vijay Vishwanathan wrote an article that CGM helped in diagnosis. Though sugars are okay, the mango eating during this season was detected by this continuous glucose monitoring. They were able to detect that when they had a mango, the spike was there. So that CGM meters. So there are techniques. It is all depending on the individual complications he is having, the other comorbid conditions like hypertension, obesity, dyslipidemia, kidney issues or any other issues he has that needs to be considered into taking it forward. But it is important that the individual who has diabetes has to be taking the medicines properly, has to walk, eat food half stomach at least, and monitor diabetes. If it is under control, don't have to see the doctor, but if at least once a year see the doctor to see if your nerves are okay, eyes are okay, ECG is okay. 5 years of diabetes and above, definitely check, irrespective of the age, check your ECG annually. And you will base the concept of giving ecosprin and cholesterol medicines above the age of 45 for a diabetic patient is gone. How much of prevention is not there with them. So, but still, all older doctors will give an aspirin and a cholesterol tablet to prevent complications due to diabetes. So, exercise, diet, self-monitoring are the basic requirements, and a lot of psychological support at various period of time, and the ups and downs one's doctor has to be discussed with the doctor in personal level and got to it. So assess, advise, agree and assist and arrange the diabetes and it is not to be worried about, but you can live well with diabetes, managing one's behavior, eating habits and attitude towards life, and that will help us live a good life with diabetes. So what is the mission is to educate the patient. Long-standing diabetic patients of mine, I don't manage diabetes. They manage their own insulin dose, they manage their own medication. It's only I'm bothered about the other complications, is it there or not. That is all I take care. People fight with me when I start insulin, but later on they feel happy when sugars are controlled, they are happy, and they themselves monitor, manage diabetes themselves. And every year 14th November on the birthday of Banting and Best, World Diabetes Day is celebrated across the globe to give education. Each year there is a theme to educate the people with diabetes and the community at large, so that at least one person or few people understand what it is and help their family lead a better life. It is not how long we are going to live is determined by us, but having a healthy life and quality of life to be good as long as we live is what is our goal. I thank you all for the patient listening, and I thank Theosophical Society. If there are any questions around, I will be able to answer them and help you out.
Does yoga help diabetes?
Yoga is good for controlling BP, controlling stress, and to some extent there are some postures in younger age you can do, but as we grow old we will not do that postures that help There are studies to say yoga is helping diabetes. They are all brief studies. Any study is a brief period of protocol. We study to 3 to 6 months that it is beneficial. But long-term continuous process, it is difficult. But yoga definitely calming your mind, BP control, breath, respiratory control is definitely useful. It is more flexible, flexion of the body is maintained as long as you practice yoga. But walking causes circulation benefits, heart lung conditioning. When you want to go see the doctor and heart doctor, they ask you to do a treadmill. They make you run on a inclined thing. So that is more important. Walking is making your heart and lungs healthier, better.
I just wanted to understand this better, what you have told. Is if HbA1c, if HbA1c is 10 and that day itself the fasting is 120 and maybe the PP is around 160.
Yeah. That is what.
So here you were saying that just now you said about the mango eating. So does that we know that the spike is there and it fluctuates. So if HbA1c is 10 and PP and the fasting are okay within control, does it require any change in medication? It doesn't. That's what.
See, there is a known cause of why your HbA1c is high. We have not been adhering to the diet properly. So correct that. 90% of the control abnormalities are with the patient. So we have to first discuss with the patient regarding why things are not there. If HbA1c is high, as I said, fasting postprandial normal means in the last 3 weeks he has had some sweets, rich food. Rich food can be any wedding, function, festival, like that. So this causes higher HbA1c and abnormality. So no change in medicine. Repeat the test again after a month or two. If it is persistent, then I don't adjust diabetic medication based on HbA1c. Try to correct the diet habits, walk more, same medicines to be continued. Only when it goes up, fasting or postprandial going up, only then we require a change in medicine. There are other two things in medication and diabetes that we should remember is, one is drug failure and other is drug tolerance. Drug failure is again two, primary and secondary. I start a drug, say metformin or glycogen. After 3 months of this medicine, if the drug fails to bring down my glucose level within the acceptable range of 120 and 180 with the maximum dose, that is drug failure. Same thing happening after 2 years is secondary drug failure. Drug failure is common with metformin, drug failure is common with sulfonylurea. The newer drugs, 15% of the drugs may not be acting efficiently. So we will have to do multiple medications to help to control. Eventually in type 2 diabetes, after 5 drugs or 6 drugs, today 8 drugs are there, we add an insulin. Again insulin, there are multiple medications that are helping the patient achieve better control. So it's, when I started practice, we had only 3 drugs. Today we have 8 drugs to control. There are newer molecules coming out. There's next year we'll have one insulin which works once a week. So from 365 days injections, we are going to have 52 injections per annum. That's all, once a week insulin. So ICODEC is that insulin that is coming out. And there are now with people with lot of obesity and diabetes, insulin with a drug like weight reduction drug combination, they are also coming out. So this helps in better control of diabetes, weight reduction and thing. The only thing is the fear of insulin, which was there previously, is slowly coming down with better education and understanding of the people.
Thank you, doctor.
Ozempic, they call it.
Ozempic is now coming a newer name called Wegovy,
So once a month.
once a week. Wegovy is the Indian product. Ozempic is the US or outside India product.
Has it come in the market now?
Yeah. Other than Ozempic, now it is Mounjaro from Lilly and Company.
Is another Rhizodec.
Rhizodec is a combination, it's a newer insulin, mixture of short acting which acts for 4 hours and another one acting for 48 hours. Rhizodec is a designer insulin. It's a combination for long acting. Okay. So, more weight loss, Mounjaro is the latest. Wegovy, what was called as Ozempic outside, is called as Wegovy in India. Yes, sir. Mounjaro is around 4,500 rupees, 5,000 rupees per shot per week.
And this Wegovy?
Will be around the same. The previous one, Trulicity, which is available in the market, is for 2 weeks you get 4,500.
Doctor, thank you for enlightening us. You have been telling that one reason is your genetics for
Yes.
diabetes. How far the stress levels play a role in somebody developing diabetes newly? First thing. Second question is, you said you generally suggest walking for people with diabetes. Suppose the person is not in a condition to walk or move. What kind of thing you will be suggesting?
When you have the gene in the body, for all women, pregnancy is a stressful factor. So it exhibits in pregnancy. So like what? Stressful events occurring in it can be environmental, office stress, financial stress, any physical. Some people come with diabetes with high values at heart attack in ICU. Once that is settled, go back to the room, diabetes disappears. So stress diabetes is common, where it disappears. But once you have the gene, stress of various kind can precipitate, and if that is persistent for long period of time, can precipitate diabetes at any point of time, at any age, number one. When you are unable to walk due to various reasons, my medicines go up. I will require slightly more number of medicines to control diabetes compared to usual individual.
So that will have a direct impact on the kidneys also.
Uncontrolled diabetes affects your nerves, eyes, heart and the kidneys. Diabetic medications are safe. It can only cause gastric disturbances. They don't affect kidneys. It is only your painkillers like Brufen, Combiflam that affects the kidney compared to diabetic medication. It is diabetes, long-standing diabetes that affects the kidney.
Right.
Because of vascular changes, not because of the medicines. This is a common myth in the public.
Is it all right to take juices?
Only juices allowed are tender coconut water, lime juice,
I mean, you can actually give tender coconut on an everyday basis and then see what is happening to it.
No, it is. We are not going to have juices every day. Tender coconut can be had. Lime juice, orange juice, and tomato juice are acceptable. See, we are all humans. We always break the rule. So,
What about plantains? Plantains can be had?
Malai Vazhappam, Elaki can be had. Other plantains, if there is no other option, half of it. When sugars go low, I give a sweet.
Okay.
So, nothing is hard and fast. If you go to a wedding, they have a sweet, idli vada or something like that. If you are eating the sweet, reduce the number of idli or vada. We take 2 idlis, vada, pongal, and then the sweet, your sugars go up heavily. If you eat the sweet, make it half a idli, half a vada, then it comes to control.
A much debated topic about which one is better, chapati or rice.
There is no difference. As
Both are
carbohydrate content is similar in all food.
Both are same.
What is important is complex sugars and simple sugars. All the food items contains complex sugars except the simple sugars stated like honey, brown sugar, country sugar, then jaggery, all this contains.
Sir, my question is regarding stomach. So there is a notion that dysfunctional gut may exacerbate diabetes. I mean that it may go overboard. So because the dysfunctional gut is gut congestion is causing your breath to go. I mean, it affects.
Yeah.
So your experience, sir.
Diabetes per se causes, long-term diabetes per se causes, like the changes in the nerves in the feet, there are changes in the nerves in the gut. Diabetes gastroparesis is there. That means after eating few handful of food, your stomach bloats. There is bloating, constipation and diarrhea occurring recurrently. I will have constipation for some time, I can have diarrhea also. These are part of the nerve weakness of this gut. There are no particular drug that controls, betters the gut difficulty. Not digesting the food is a different issue, but bloating is another major issue. If you see, most of the long-standing patients with diabetes will have this bloating complaint. I use chlocropamide, perinom, the olden day drug, is being useful in controlling this thing, pushing the gas out to some extent. Perinom.
There's another area which are not diabetic. I've been dealing with diabetic patients living with me for a long time, which we didn't give much importance initially. It's a lack of sleep. The sleep pattern not being, we take it for granted when elderly people snore or get up in the night. We take it okay with old age. But recently I had this experience with where it was accidentally diagnosed this what is called apnea.
Sleep apnea.
Which was remained undiagnosed. When it was diagnosed and we applied that relief through a CPAP machine,
BiPAP.
everything came down. The diabetes, the blood pressure, everything collapsed as if.
Yes, sir.
So one of
This is one acceptance by the patient, and today this technology is there to understand and assess. The sleep apnea is the most difficult thing in the body, an individual, where it is difficult for us to diagnose without these instruments, and
that's true.
these have been available in the recent past, the last 10 years only. And BiPAP and CPAP machines are multiply available now extensively, only recent past. Previously, sudden deaths were common in diabetic patients, and that was basically because of this sleep apnea and sudden arresting. Apnea means stopping of breathing. If it stops breathing at night when you sleep because of mechanical obstruction or because of obesity was a major reason. Anybody who is snoring, who has a big body, overweight body, definitely has to have the sleep apnea study. That is one reason. Stress is another reason. Diabetic people have neuropathy that also affects them only during the night, causing pain and tingling sensation in the night, though they are not able to sleep. Though medicines are there, but sleep apnea is a different topic altogether. It requires better understanding amongst the family. This machine has to be applied, and people will have a better quality of life with that. As I said, taking care of medicine yourself helps in better care as quality of life improves so that we live healthier as long as you are destined to live.
Is good sleep and diabetes directly proportional, sir?
No, diabetes is higher in people who have lesser sleep because of hormones playing a major role.
There are two kinds of diabetes. Diabetes mellitus and diabetes insipidus.
No, so diabetes insipidus is a disorder of pituitary. So there is, you will have glycosuria. Urine sugars will be there, blood sugars will be normal. That's a disorder of the pituitary gland, not because of pancreatic diabetes. Pancreatic diabetes is more it's a chronic condition. It's not a disease. It's a disorder caused by disorders of insulin secretion and action.
So can it be made reversible? I mean,
Yeah, it's a wrong terminology to say reversible, which is being promoted extensively outside. Weight loss can bring down, once you are diabetic, you are always diabetic. You are under good control or poor control. Weight loss can bring you sugars under good control, and you can be on remission. Remission is state of normalcy for a long period of time. Any single triggering factor, you can become diabetic at a later stage. So remission is the terminology should be used, not reversal, number one. Number two, weight loss helps you getting remission. Sustaining the weight loss program by the reversal thing is difficult for over long period. They are very, very stringent adherence. It is difficult.
and in remission, there is no medicine, only the diet control.
Diet control, no medicines. Avoiding simple sugars.
What's the cause for fluctuation in sugar levels? High, low, high, low.
Sir, stress, that's why I said breakfast, lunch, dinner is not the same. What you have today, you don't have yesterday. Exercise pattern is different every day. Stress factors are different every day. High and low are going to be there based on what you are having. If you have 365 days, same height, weight, milligram, centimeter, measured food without any change, body's response to the same stimulus is different. Body is too dynamic for us to understand. You have to test, see the values, and then based on the circumstances around you at that particular moment, we take a decision. There are many instances where people have come with changes in ECG of a heart attack with a vascular spasm. By the time they go to the hospital, the spasm is released, ECG becomes normal. So many examples are there where it is based on the situation, circumstances that needs to be taken to.
So this is a general question. In Corona, people had high fever for number of days. So diabetics were the worst affected. So my general question in that perspective is, see, pancreas is part of the endocrine system. It is a secreting gland. So when the internal temperature is so high, it is possible that endocrine glands may go dry. Maybe temporary, I don't know, but it is a possibility. So the root cause may be a person's system is in such a condition that one or two glands are going dry. So that is one general question. Another question is, see, humans are supposed to be the advanced species in this world or in this plane of existence. So are other beings also in a similar way, there is a rampant increase in diabetes incidence, or it is only with humans? So if it is only with humans, then that means we are mismanaging ourselves, right?
Yes, sir. Corona treatment itself is a difficult thing. I myself went through it. I had 520 milligrams of steroid given morning and evening for 10 days. Sugar used to be 500 to 600 continuous. So personally, I have had it and gone through the same experience of any corona patient would have had it. High dose of steroid only saved me, and I am alive because of that. I have no choice. I have to endure. These are all iatrogenic causes of developing diabetes. Doctor's medication brings diabetes to the individual. One. So there is nothing called going dry. When you are susceptible for diabetes, fever causes, infection causes diabetes. Diabetes increases infection. This is a vicious cycle. We have to give antibiotic as well as insulin to break and bring it under control. My friends are there in the university, veterinary university, they say, and I help my friend treating diabetes in dogs. So it is also prevalent. Today their technology is also huge. They have, I give what insulin I give to humans to the dogs. Under my guidance, he will titrate the dose and adjust and see the dogs. So they are trying to help dogs with diabetes to a great extent. There are cancers in dogs, there are things which they treat extensively. And these are the things. But it is prevalent. It is only those who are attached to the veterinary university are able to find it out better and manage it better compared to private. That's what I feel.
I want to ask how it is related to DNA and heredity.
Sir, heredity is DNA, sir. All genes, your parents, grandparents, they pass. 50% from your mother, 50% from your father. That's all.
Diabetes also pass?
Yes. If your father is diabetic, 60% chances of developing diabetes. Mother is diabetic, 70% chance. Both, 90% chance. As you grow older. Still you can develop diabetes. You may be the first person who can develop diabetes because of stress and gene.
Even if heredity is not considered as a factor.
You can be the first person, sir. There is one gen.
So, no, what I mean to say is heredity is not important for diabetes.
Hereditary is important. Sometimes you may be the first person in the family. I have seen the son or daughter getting diabetes first. After 5-6 years, the parents getting diabetes.
So we didn't have these cases about 50 years back or 60 years back. Only it has started. Maybe. It has
Sir, from when I started practicing 35 years ago, understanding of diabetes and managing diabetes has drastically changed. People are more aware of diabetes. Testing is extensively done now when compared to 50, 60 years ago. Going to a doctor was a Herculean task those times, but today there's a lot of awareness. People go at the earliest symptom, and better awareness creates better early diagnosis and better management.
So what I mean to say is, as you have said now, sir, it is a lifestyle disorder. So if you change the lifestyle pattern, suitable accordingly you change it and see that the diabetes doesn't occur. Without medication, is it possible, sir?
It is difficult. Can you be without your vehicle? Can you travel long distances in bullock carts? These are things that have changed. Things cannot change towards backward. Unless until you go retire in a peaceful village where you are able to walk around the fields, relax yourself, not bother about your worldly requirement, then you can change your attitude. Your life is more calmer, peaceful. Currently, when you are living in a city, it is difficult to go back to all this system. We may say half an hour walk. How many of us walk half an hour a day? 90% walk at least 5 days a week or 3 days a week. Most of the days, some pressing work takes over. That is how it is. So going back to physical activity things, it has to start from young age. Starting at 50, 60 is going to be a difficult thing to continue. By then you are going to have other comorbid conditions such as heart, BP, cholesterol, peripheral diseases. Something will be there when you test. Master health checkups diagnosed a lot of heart problems at an early age and help them live a better life later on. So things are there where it is useful and how you take it.
I just wanted to share on a very positive note, as I told you earlier, that I have been living, my wife is diabetic, living with her with that condition for 25 years. What I found initially, that once you get it, you are so frightened of it. And so that fright itself becomes a vicious circle. And one incident which changed my wife's attitude towards diabetes was about 10 years back. Suddenly in night she felt uneasy and all that, and immediately we rushed her to the hospital and they said she might be having a heart attack. Troponin test was done, it was positive. And by next morning the troponin became normal. But they said, no, she is diabetic and she will be having a lot of blockades. So they went for angiography and they asked me to sign. In case the blockades are more or something, they might have to go for a bypass, whatever it is. I remember I was waiting anxiously outside, and one word which was all the doctors were repeating was, because she is diabetic. Whatever is happening is because she is diabetic. So the doctor came out and he says, sir, unfortunately, there is absolutely no blockade. Why unfortunately? Because he was fortunately expecting as a doctor that he had predicted. And all her arteries are like a child. The maximum blockade I could locate after 20 years of diabetes was 30% in one small artery. So this was virtually changed my wife's attitude. What are you frightening me for? I have got arteries of child and you call me because of diabetes, I'll have this, I'll have this. Without having, I'm having all the time in my mind. So one was the attitude, there are certain things with age will come. With any medicine you take, any walking you do, you have to go down only after some time.
Yes, sir. This is what we need to understand, that we have to take care of ourselves and eventually manage diabetes in a reasonable control, lifestyle, moderation in what you eat, exercise, don't overdo anything. And all doctors feel happy to say, blame it on diabetes because you will not ask a question because you are responsible for diabetes control. That's all.
So that was one experience. And then after that I found that life became more cheerful, better. Sometimes it spikes. For various reasons, as you told, you have a lot of parties, mango season came, you started eating mangoes. After all, she keeps saying, I can't throw away my life for living long. Sometimes certain compromises.
That's what I understood, sir. That is why I propagate these things in my practice. I analyze and teach. I treated one patient. He said, I have struggled hard in my life so far, and now I am rich and I can afford everything. Don't restrict my food. So from that day, I stopped restriction of food. So let them eat what they have done in moderation. That's all I do. So you change according to the requirements of the individual and the society at that time. Thank you. Yeah. No, sir. All sugars, any form, it can be had when one function is there, but it is all harmful. It increases glucose.
Okay, so if no more questions are there, I think we can proceed to the closing. But I must say that this has been a session, the most interactive session that we have had till date. And thanks to Dr. Srivatsa again to be here with us and share his experience and his knowledge and make us more aware about diabetes and how to take care of it. And I think he answered almost, 50, 60 questions. So that was a very interactive session. Thank you on behalf of Theosophical Society. I extend our gratitude. And now,
Thank you.
as a token of our gratitude, I respect Professor Shinde, who was a former librarian of the Adyar Library, to offer these books to Dr. Srivatsa.
Really, diabetes is a silent killer. And we have Brahma, Vishnu, Mahesha. Mahesha has entered. He is a regenerator. He is a silent killer. He will end with that. So we should not hate diabetes. Be with it, accept it. That's what I think. Very nice discussion today. Thank you very much.
Thank you, Dr. Srivatsa, and thank you everyone for coming, and see you next month with another session. Thank you.